Since the pandemic had started, things had gotten very dark, very bad for him. And he admitted that he did have a plan.
What you're about to see is courageous, raw, and powerful.
You're loved, man. People are here for you.
We're in a crisis right now.
1 year into the pandemic, a new crisis is emerging.
I think everybody has been impacted by this time, obviously, and there are varying levels of trauma.
Students struggling to learn from home.
This has hit everybody super hard.
Isolated from their friends, sparking stress, anxiety, and in some children, far worse.
Absolutely, it's devastating to know that kids are in pain.
School districts now trying to help students who are suffering.
Until we can address their mental health needs and their wellness, that they're not going to be able to learn.
Seeing the damage up close and preparing for what's to come.
I think over the years, it's something that will affect them and us for years to come.
And good evening, everyone. Over the last 4 months, we've done a deep dive into the mental health of our children.
One thing is clear from our extensive reporting on this issue: many students are struggling. And a warning, tonight's broadcast includes difficult topics like suicide with emotional and candid interviews. In an NBC3 special presentation in February, we began to investigate the pandemic's toll on kids in our community, getting firsthand accounts from those inside schools and doctors seeing the devastating impact. Children suffering so much, they're being admitted to the hospital.
Now we are 2 months later. Experts say many children are still in the throes of stress and anxiety, depression, suicidal thoughts, and attempts.
Tonight, we will take an in-depth look at the problem and the solutions. And we begin with the crisis unfolding in our community. When schools abruptly shut down in March of last year, bedrooms quickly became classrooms. Parents turned into assistant teachers, and students started to suffer.
We know that, kids are at risk of suicide and depression right now more than ever. This has exacerbated an issue we already knew we had.
Altmar Parish Williamstown Assistant Principal Kristen Moses says students are struggling with feelings of depression, anxiety, and hopelessness. And they are not alone. The Baldwinsville School District surveyed students at the beginning of the school year in September. What they found was startling.
17 to 20% of our kids that took that assessment were rating that item of "I've thought about self-harm."
Carrie Lamacchia heads up the mental health team in the Baldwinsville School District. She sees the impact up close.
How heartbreaking it was to sit with a student and discuss their feelings, or call a parent and say, "Hey, did you know this? Were you aware of this?" And their heartbreak.
Yeah.
Like I could cry. Or even just like walking that kid to the car to see the parent.
Liverpool High School social worker Tracy Lunny says many students feel lost, and she worries about the long-term impact when they return to school.
When they start walking down the halls, we might even see a peak in anxiety again. We might see more peaks of depression again. There might be kids who don't think they can do this.
Just this week, students in some central New York schools started returning to class 5 days a week. After a year of virtual or hybrid learning and isolation from their friends, they were finally able to head back to class in person full time.
But the damage is done. One of the students severely impacted is Peyton Lance of North Syracuse. Last month, we introduced you to his mother, Kimberly, who says Peyton came to her earlier this year and he was in a dark place.
A few months ago came to me and admitted that he was having some very extreme difficulties. Couldn't find his happiness anymore. It was a very sobering experience.
Tonight, we are back with her son Peyton and another local high school student.
I sat down with them for a very revealing conversation about what's really going on. I asked them, Megan, to level with me. And they did, in the gymnasium at Chestnut Hill Elementary School in Liverpool, so we could be spread out and COVID safe. Peyton, the 9th grader at CNS, the baseball player who made the team last year only to see the season scrapped. And Colin, the 12th grader from Baldwinsville, who's deciding on college right now. He's an accomplished high school senior, who advised the Board of Education on mental health matters as a student representative. Colin and Peyton's moms watched the interview from a hallway on closed-circuit TV. We wanted them nearby, but not too close, so the boys could speak for themselves, and they certainly did. We start easy.
Okay.
We start very easy. These are yes or no. Hand up for yes. How's that?
Okay.
Is that good? The last year has been good for me. The last year has sucked for me. That's 2 yeses. All right. In the last year, I feel like I missed out on a lot. In the last year, I gained some things. Okay, that's nice to hear. Lately, I feel like in all of this, I hit a wall. That's a yes. In the last year, someone I know has had COVID. In the last year, someone I know died with COVID. A lot of adults over the last year have been thinking a lot about you guys, people your age and younger. How to keep you safe, about your mental health, about what to do with no sports or activities and things like that. How have the adults done?
I think all things considered, like, there's not a lot they can do, but from what they've been able to do, I think they've done their best.
Done their best. What about you, Colin? The adults have been thinking a lot about you. What have they done?
I think that, like, sort of like what Peyton was saying, yeah, they've done a good job, and nobody knows what to do. And I feel like this word is tossed around a lot, but this is completely unprecedented. Nothing like this has ever happened before, really. So, all things considered, they've done a really good job informing us. All the teachers and parents and coaches have done a great job of checking up on us physically and mentally, so I think they've done a good job.
Was there a period for you where you thought, this is too, I just can't do this. This whole Zoom school, I'm done. I'm just done.
It was kind of like the beginning of the year toward then. There was like a week or two stretch where I would just sleep all day because like I just could not keep doing that. It was just too much. Not being able to see anyone, just like he said, or like Colin said, just typing away your computer every single day like a robot.
You both say the word robot. You both use that term. That's really what school felt like? Like over the course of the whole thing, or were there periods where it was robotic, or has it now just become robotic? Can you walk me through that?
At the beginning, yes, because we were only going to school one day if you actually went to school.
Yeah.
So you would just go that one day and then the rest was just virtual. So you'd be doing just the same thing. You would attend your Zoom and then just do your work, click away, and then you're done. There's very little interaction with anyone, if at all.
I've seen some Zoom classrooms. The teachers are trying to connect. So you're just saying there's really no way to adequately connect via the screen?
Yeah, and that's one of the toughest things. Like, we've almost become desensitized to Zooms and Google Meets at this point. I remember back in like April and March, like we would log on and be like, "Hey everyone," and now we log on and it's like, "Okay guys, here's your lesson for today." Like, it's so dry and bland, and it's different, but it's not a good different.
You're telling me that kids don't talk about mental health with each other.
Mm-hmm.
When you're texting friends and you're, if you can see them in person, whatever have you, nobody's getting together and saying, "Hey, how's your mental health?"
Yeah, no one is.
No one is. Is anyone?
Nope, nobody is actively talking about mental health like frequently. I mean, there have certainly been a couple times when like teachers have seen a distressed student and they're like, "Hey, maybe just take the night off. You can just go home and meditate and you don't have to do the work for tonight. Just take it off." And I think that's super helpful. And I think when you were mentioning earlier about how the adults are handling everything, I think the empathy and sympathy that those adults have is a key role in how they've been helping us kids.
We've got to touch on something that's probably the most sensitive topic of all. And I don't know if anyone has brought this up prior to now with either of you, but I've got to talk about suicide because that is the scariest thing out there for any mom or dad or anyone who loves any child. Do people in your world, friends, family, other folks, talk or ask about suicide?
No, not talked about at all. I've never really met anyone that's actually talked about it, like I'm in need. I've never.
And no, none of your peers have ever brought it up with you?
No, not once.
Okay. What about you?
It's the classic scenario of we don't address it until it becomes a problem, which is a problem within and of itself. In terms of discussion of it, with my closest friends, and this is some of the scariest things I've had to endure with my closest friends, it's sometimes mentioned and even that, you can imagine how it must freak a 17, 18-year-old boy out. But it's sometimes mentioned, but mostly on a wider scale, it's seldom mentioned, if at all.
These boys are so incredibly mature and so insightful for their age.
I loved spending time with them. Both of them had so insightful and really speaking from the heart. In a couple of minutes, though, you're going to see that conversation continue when the moms join us. Remember, they were out in the hallway. They could hear and see the entire thing. We wanted them close, but maybe not too close. The moms come into the gym, sit down next to their sons, and no one in the room was prepared for everyone in the room to fall apart during the conversation that's about to continue.
All right. Well, what those students said about mental health is true. A 2020 survey by the American Foundation of Suicide Prevention finds 56% of students said they were moderately, very, or extremely worried about their mental health. Half of all students reported experiencing anxiety. 1/3 had depression, and almost a quarter said they knew someone with suicidal thoughts since the beginning of the pandemic.
A study by NBC News and Challenge Success found remote students were more likely to report stress-related symptoms. It also revealed students felt less connected to school. Half said their relationship with their teachers was diminished because of remote learning. 47% said the same about their relationships with their friends. Back in February, a Liverpool pediatrician was doing all he could to really raise alarm on all of this.
Dr. Robert Draker of Summerwood Pediatrics told us he has been overwhelmed by mental health cases among children. In a letter to his patients, Dr. Draker said he has never witnessed so many children suffering from anxiety and depression. 2 months ago, Dr. Draker said he was admitting 5 to 10 children to the hospital each week. And now he tells me it's only gotten worse.
I mean, I don't think I've had a week recently where I haven't admitted at least 2 or 3 kids per week with suicidal ideations or self-harming behavior, like cutting.
Have you lost a child to suicide in the last year?
Yes.
How many?
3. So, suicide in children is an impulsive act. And you don't see it coming sometimes. At the end of my day, I'm exhausted. I'm just mentally exhausted dealing with kids telling me things that I don't think kids should be experiencing or suffering with. But you just have to keep going.
In your conversations with children, have you gotten to the root of why? Why are they anxious? Why are they depressed? Why are they suicidal?
I think the prevailing sentiment that I hear from children is that they feel sad. And they don't understand why they feel sad. They feel like there's no other way to stop the pain they're experiencing except to no longer feel.
What do we need to do as a community, as a society, to really dig in on this issue and get kids the help they need?
You know, I think we have to recognize mental health issues as an illness, just like cancer. There is inadequate financial support to get the services that everyone needs, not just children. And also, even though it's better now, I think, mental health always has a stigma associated with it, which is something we have to recognize is a disease state which you can recover from, but with the appropriate help and guidance. And we don't have enough resources.
Does there need to be more done either in a pediatrician's office or in school to screen kids on a consistent basis for mental health?
We do, and in part of a regular exam now, we do mental health assessments. We use anxiety questionnaires, depression questionnaires for children.
Do we talk about mental health enough as a society?
I think we're getting better at doing that. I think for a while, many people used to minimize the significance of mental health, saying, oh, come on, it's just an excuse, and people, come on, buck up and just stop being mopey and just get over it. But I think now we're recognizing that mental illness is truly an illness.
And this is so much more than being mopey. Wow, the doctor himself is at his wit's end and exhausted. Yeah. This is a man who goes home at night and he's exhausted? That's not normal.
Yeah, this has been a rough year for the pediatricians as well. To meet the need, Onondaga County is making significant investments in mental health.
This is a $5.5 million program to expand mental health services. The money will be used to support all students, from those showing some signs of concern to those in crisis. Syracuse City and county schools will add 93 new positions to focus on student mental health. And every school in Onondaga County will have access to an on-site, school-based mental health clinic. Children who never needed support in the past, they do right now.
The new mental health resources will be in school starting in the fall.
While Onondaga County makes that investment, state lawmakers did cut funding for some mental health services in this year's budget, eliminating 200 inpatient mental health treatment beds across the state, on top of cutting 20% of available inpatient beds in the last 7 years. The state did authorize mental health urgent care centers to be open around the clock every day of the year. And we're still working right now to get the details on where these are going to go up and when they'll open.
What we are about to show you will likely leave you furious about why your elected representatives in Albany are cutting funds for mental health programs at a time when people need them the most.
Just a few minutes ago, we introduced you to Peyton and Colin, two local teens whose lives have been upended by the pandemic. Their mothers were just outside the gym, in the hallway, watching the entire interview. We invited them in to continue the conversation. And what happened next was revealing, stunning, and raw. And it may be the most riveting and emotional television moment that I've ever been a part of. Again, a warning. This is a heavy conversation you're about to see, and some people may find it tough to watch. We talked in our conversation with the guys about something very serious. We talked about suicide. We talked about how for adults, that's their biggest nightmare, fear. It strikes fear in anyone. Is this something that you've thought about, to check in, to speak openly? I'm just curious about how you've dealt with it as a family, this issue, or if you haven't.
Before the pandemic, not really. I felt like my kids were, well adjusted. They're in extracurriculars. The grades were great. They had an excellent group of friends, some of them going back to kindergarten, first grade. Then, things kind of changed with the pandemic. Is it okay? Peyton came to me early in the school year and expressed that he was having difficulty, that he, in his words, wasn't doing okay. In talking to him, we found that he was having worsening bouts of depression and anxiety for a couple years, even prior to the pandemic. But since the pandemic had started, things had gotten very dark, very bad for him. And he admitted that he did have a plan. That was very difficult to hear. It was very, very scary. I'm glad that he came to me and he sought help. You know, we went to the pediatrician. He is one of those kids we had to resort to medication with. He's been in therapy for, you know, about 6 months or so, and things are looking better, much better. But that was not an easy thing to hear. As a parent, I felt like maybe I had failed in some way, that I didn't recognize something I should have. Maybe I didn't talk about it enough with him, you know, before that. But I realized it doesn't matter what I did or didn't do before. It just mattered what I did going forward. Get him the help he needs, support him, and a lot of praying. And so that's what we did.
Peyton, you have a very special mom who loves you a lot.
I do.
Loves you a lot, a lot, a lot.
And
you folks are strangers to me, and I can feel the love that your mom has for you and the pride that she has for you. That means a lot. That means a lot to me. I'm glad that I'm here to see this and witness this. What is your message to other parents? Should you bring it up?
Talk about it.
Say the word. Say the actual word.
Say it. Check in with them. Ask them what's
The checking in
going
is
on.
different than saying the actual word. Say the word.
Say the word, and when I say check in, it's not just the, hey, how's it going? How was your day? Because you're going to get those, was fine, was good. You know, did you learn anything? Yeah. You know, you're going to get those one or two, you know, word answers. When I say check in, sit down with your kids, have deep, meaningful conversations. Pay attention to what they're drawing, what they're writing about, what is going on in their room. Because I think that there's a lot more of this going on out there than I think a lot of us really realize, or at least that I realized until we experienced what we experienced.
Peyton, what's the best way for a parent to really check in and get a good answer? Not just the, yeah, everything's fine, yeah, okay, mom, yeah. But what's the best way for a parent to really get the right answer, the correct answer about how you're doing?
You have to make them comfortable. That's very important. And if you ask them something they really don't want to talk about, you have to give them that leeway, because it would be very awkward to just like, tell me now, because you wouldn't want to go to them ever again if they're like, just tell me. You got to make them comfortable.
You guys have...
Can I just say something?
Yes. Yeah.
I don't know you guys before today, but Kim, Peyton, I want to hug you. And we can't, right? But Peyton, please know that when there are dark days, there's always someone, okay? I tell my boys that. They don't listen, so maybe you'll listen. I know you do, but it's hard. There's always, when you feel you're loneliest, there's always someone.
You, sir, are a fine and sensitive guy, and you had a little trouble listening to that.
Oh, yeah. Well, I guess if I were to speak to it, like, my mom was saying, like, we just met these people 30 minutes ago, and I don't know, it's just hard, like, Peyton, you got your whole life ahead of you, man, like, you're on a great team, it sounds like you're a bright young man, a great athlete, like you're loved, man. People are here for you. And I'm glad that you have such a tremendous mom who's willing to help you out with this, because not all kids and not all moms know how to go about this. And that's really what's heartbreaking and devastating about it. But I'm just glad that things are doing better now.
It's hard stuff.
Yeah.
It's hard stuff. Let's take a breath.
Let's take a breath.
Yeah. First of all, I think it's important to point out sort of just how this all worked. You set up the interview with these young men, and then I went in and conducted the interview. I had never met them. I had no idea what was going to be revealed in that interview.
And neither did I.
And neither did you. And we ended that interview, and I thought that pretty much the same way I feel now after seeing it again. I thought, oh, we've got something here that if other people see it, somewhere in some household, some parent, some older sibling, someone will see it and think, you know what, what's going on in that room is not right now, and I've got to take some action.
Yeah. And check on the people that you love.
For sure. And as we continue,
we have seen the intense challenges children and teens are facing. Next, we look ahead to the solutions.
For those who are already watching on the CW6, we have good news for you. Sit tight. For those who are watching live right now on NBC3, Channel 3, we have a rather big ask, and we think that it's going to be worth it. We're going to continue this conversation on the CW6, so we need you to switch the station. We're diving into what some school districts are already doing to address the challenge and what more needs to be done.
Coming up for you, a test that's revealing mental health problems in children because of the way it asks the questions. We'll show you how it works and meet the Central New York educator who created it.
You're not able to concentrate. You're not able to deal with other things, so it's good to talk about it.
Social emotional learning underway at a Syracuse elementary school, and they think they'll need it more now than ever.
Expert advice to move us forward. We will get fresh perspective to help your family. Over the last half hour, we've exposed a crisis unfolding in our community.
Under the weight of the pandemic, children suffering from major mental health concerns.
We know there's a problem. The question now, what do we do about it? And how can we support these kids in the years ahead?
We took that question to mental health professionals in school districts across central New York. All of the experts agree, in a perfect world, we would be increasing mental health support for students.
I think this topic always needed to be in the forefront. I'm sorry that it took a pandemic to have people more talking about it. That is very sad to me. We're seeing it happening younger and younger. It's not just 14, 15, it's 6, 7, 8 years old. So I think it is a bigger discussion. It is a larger discussion than just a school district, than just a county, a state. It is national.
In the wake of tragedies like the Sandy Hook school shooting in 2012, mental health dominated the national conversation, then disappeared from our radar.
We've had these crisis situations and we say it, and we need more money, we need more of this, we need more of that, and yet here we are. What do we learn from this? And do we see it as an obstacle, or do we see it as an opportunity to figure out the pieces that are missing?
They all agree it's time to normalize the issue of mental health and use the trauma inflicted by the pandemic to dig in on this issue.
Reducing the stigma of mental health and being able to say we all have mental health. Talking about this, going to a counselor should be as normal as going to your 6-month, dental checkup, right?
Yes, if not now, when on all of these issues? The last year's been filled with major disruption for students, we know.
With some never stepping foot inside the classroom, others only in school in person 2 days a week.
Last spring, schools suddenly shut down. Businesses like grocery stores, gas stations, and daycares were deemed essential and remained open. But schools stayed closed throughout the spring, into the fall and winter months. The Onondaga County executive says, as he looks back, that was a mistake.
I think if the pandemic taught us anything, if we were going to go through this in 24 months, in-person learning would be essential. We would figure out a way to just do it.
Ongoing COVID testing of students, teachers, and staff turned up very few positive cases. And this month, schools across Onondaga County are reopening 4 or 5 days a week.
With children learning from home, parents have seen the struggles firsthand.
Giving moms and dads a big window into the pandemic's impact on children's mental health. And it's driving them to get more involved, some of them, and run for school board.
Nobody was doing kind of what was needed to be done. And I said, well, I guess I'll just do it myself then, because parents need a voice and these kids need a voice.
I have decided that if I want to be able to help instill policies, help make change, that I can't do it by just talking to parents or calling administrators or voicing my opinion through Facebook or social media. I have to take action.
Many of the children who attend the school we're about to visit next came into the building with a host of issues pre-pandemic.
Yeah, Delaware Primary on Syracuse's west side draws students from some of the poorest areas in the city. And we found on a recent visit a key program at this school used for many years could pay off in a big way, helping youngsters with their re-entry to school. It's called social emotional learning. Since it was built back in 1915, Delaware School on South Geddes Street in Syracuse has stood for 2 pandemics. Its teachers and staff are about to learn more about the impact of the one we're in now. Are you folks ready to have more kids back in here?
Absolutely, yes. We're all excited about it. We've been waiting.
What's the best part of that going to be?
I think the best part is going to be just filling the building again with children happy to be here.
Amy Chandler is a vice principal and says the school will lean on something that infuses the day and the curriculum here when more of its students come back. What are the outcomes that you see that you know it's working?
Because children and adults cannot learn unless their emotional needs are met, unless their very basic needs are met, unless they feel comfortable, trusted, and have the ability to open up when they need to, get help when they need to. Learning cannot happen until we create a culture where children feel feel comfortable.
Knowing that the last year of COVID has led to immense trauma, Syracuse Schools makes social emotional learning, or SEL, a top priority. At the elementary level, there is a morning check-in, a chance for every student to express what they're feeling, good or bad.
We've been using the second step curriculum for 2 years now, pre-K through 5, and it gives the kids a chance to learn, focus on skills for learning, and then we go into more skills about empathy, and then eventually we go on to naming our feelings and identifying feelings. And that curriculum really helps our students to be able to identify what's going on with themselves, name the feeling, which is really tough for our kids. A lot of time our students will just say I'm mad, I'm happy. They don't know that there's a range of emotions. A lot of my kids, we've had a lot of conversations about how sometimes we just feel content. We don't have, an emotion one way or another. So it really helps our kids to be able to identify their feelings and realize that, other people have those feelings too.
Samantha Cleary teaches second grade. Ellen Sosha is a first grade special education teacher. Both agree empathy is at the core of social emotional learning.
If some child is sad and you see another child go up to them and I see something's wrong, or be kind, then as an adult you want to bring attention to that. Wow, what a great friend so-and-so is. I saw that you went up to the other child, and isn't that a wonderful friend to have who cares so much about you?
And you would do this in front of the entire class so
yes,
everyone sees
so
this.
that's what these children have missed with their social emotional learning. It's something that's ongoing throughout our day.
In teacher Samantha Cleary's room, there is a calming cube. This is quintessential SEL, a place to breathe, write down, or draw how you're feeling. Social worker Maya Arocho told me every aspect of SEL is done with the goal of clearing the path to academic learning. Is there ability to learn if you're angry, upset, sad, scared?
Absolutely.
All this list of, if you're feeling anything that's in here.
Right, there is opportunity, but you need to focus on that. You have to deal with that first, those emotions and those feelings, to help your day go on better.
So if I'm feeling like I want to scream, if I feel like I want to break things, if I feel like I want to hurt others because of something going on, I'm not learning my spelling words, I'm not learning math.
You're not able to concentrate, you're not able to deal with other things, so it's good to talk about it and go through those emotions and those feelings, and then when you talk with someone, it makes you feel better, and then you're able to learn.
It clears the path for academic learning, and to deal with the fallout, some school districts are getting creative.
Yeah, finding ways to help students who are struggling. The APW school district recognized the problem early on and found a solution. The district identified students who were struggling with hybrid learning, so they brought back 60 children who were high risk for failing classes or suffering from mental health issues. Those students have been in school 4 days a week. The 2 days they would normally be at home during virtual days were spent at school getting meals and academic support.
They're not in class in front of their teacher. They're in the cafeteria, socially distanced but we have it scheduled so teachers go in and out and help kids who might need help, so they can do their remote learning days at school. But they get that help they need at
Bernie, come on.
APW also brought in Bernie, a school therapy dog. District
Bernie.
leaders, have put in layers of support throughout the year, with teachers and staff calling home on a regular basis to check in, even doing home visits.
Oh, it's good to smile, and Bernie brings out the smiles. The Cazenovia School District started talking about ways to support students before this school year started, forming a wellness task force and making student mental health a top priority. At Burton Street Elementary, teachers dedicate the first 40 minutes of the day focused on social emotional learning.
We can talk about failure and frustration, and it's not stigmatizing or looked down upon, and it's very much part of our day. And
The district's mental health team meets frequently to assess how both students and, this is so important, how the teachers are doing. Let's not forget about them.
They're a big component in all of this. In the Syracuse City School District, there was a push to support teachers and staff during the pandemic. District leaders launched a mental wellness initiative to help staff with stress, offering free counseling for employees and their families.
It is so important that adults in this community at large and in our school community get the help that they need and feel well and ready to get back to work, because that's going to make the difference in how our students achieve and how they perform.
The district plans to survey staff to determine if the wellness resources are helping.
Okay, here's a question. How do we really and truly get inside a child's head and find out what's really going on?
Well, you're about to meet a local expert who created a new way because he says our usual approach to mental health has been ineffective. Now he's seeing promise in the way some school districts are helping kids in distress.
And to getting kids the help they need.
Jim McDougall has dedicated his life to helping children, first as a school psychologist and mental health coordinator in Syracuse. And for years, he says, we've done it all wrong.
But I still saw that what we were doing was not effective in terms of changing the outcomes for anybody. We were just diagnosing disorder, putting a tag on it and putting them somewhere.
But it was the time he spent running a suicide prevention crisis counseling hotline that left an imprint on his heart.
And seeing the incredible pain and agony that suicide causes, you just really want to do something different.
So he turned his attention to identifying kids at risk of mental health concerns so they could get help before it turned into a full-blown crisis.
We can do this, and we can seriously increase and improve students' mental health. It's doable.
He and other researchers developed a way for schools to screen children for mental health concerns. It's called the Behavior Intervention Monitoring Assessment System, or BIMAS-2, an evaluation designed to measure a child's social, emotional, and behavior functioning. It can be used on kids ages 5 to 18, a universal screening tool to look at anger management, anxiety, depression, and suicidal thoughts.
We know that's a need. And so what we're trying to do is show folks how to meet that need and how to actually change student outcomes.
The metric is currently used in about a dozen school districts across central New York, including Liverpool and Baldwinsville, and some 300 districts around the country, like Boston Public Schools. McDougall hopes it can be a useful tool to identify struggling students early on.
I've seen so many of those experiences that for so long I've often thought were preventable. So I'm really excited that now folks are making real valiant efforts to do that work.
Important work it is. The Baldwinsville School District uses this assessment to screen all students K through 12 at least twice a year. Liverpool schools screen students at 9 of its elementary schools and have discussed expanding it to other students.
This asks students on a scale of never to all the time. I've had thoughts of self-harm. I felt anxious. I fought with other people. The teens rank themselves, and for the younger children, it's administered by the teacher. Here's the president of the American Association of Suicidology.
Universal screenings provide three things. One, they provide a baseline of information about students. Two, screening is kind of like panning for gold. Right, you don't know what's in there until you're able to sift it out, and then you find those nuggets, meaning you find the kids that really need the resources. And number three, it enables you to go into more in-depth assessment so that those kids that really need it can receive the services that they need. And so to incorporate mental health issues into an existing paradigm, I think is low-hanging fruit that really is going to pay dividends.
Dr. Singer says those screenings should be done annually for kids in grades K through 12 and for college students too. He says there is value in tracking kids over time.
And says the data collected can be used by schools to potentially push for more state funding. Here are the warning signs that someone may be at risk for suicide, talking about or looking for a way to do it, discussing feelings of hopelessness, being trapped or being a burden on other people, acting in an anxious manner or agitated, sleeping too much or too little, withdrawing, showing rage or extreme mood swings. Since last spring, most children have had limited or no contact with their friends. The social interaction that they thrive on was replaced with a lot of at-home time. 4 months ago, we started investigating how all of this is impacting children.
What we found was startling. Dr. Christopher Lucas is the vice chair for hospital psychiatry at SUNY Upstate Medical University. He joins us now. And Dr. Lucas, can you attest to what you are seeing from a hospital perspective?
Well, we're actually seeing record numbers. Compared to last year, we've had 35% more children come to the emergency room. We saw the most number of children ever in the month of March. At any one time, maybe half the beds in the pediatric emergency room are filled with kids with behavioral and emotional issues. Great increases in the degree of suicidality with suicidal thinking and suicide attempts.
What is the first thing that happens in that hospital when a child is presenting with suicidal thoughts or potentially has taken some action?
Well, the first thing is you would assess their medical safety. Do they need some immediate medical attention? But later you're really trying to assess the degree and the severity of it. How serious are they about doing this? Do they have a plan? And most crucially, do they have any intent to act on those thoughts?
Dr. Lucas, we know that mental health issues among children existed long before the pandemic. Do you find in your experience that the pandemic has just exacerbated this problem that we already knew that we had?
It has. You know, there's been steady increase over the past 10 years. But I think the pandemic has done a number of things. It's put families and children under stress, whether it's online learning or the stress that families face with illness and financial difficulties. But most crucially, it's taken away many of their resources for coping. They can no longer go hang out with their friends or go to places that would previously be their main coping mechanisms.
Doctor, I'm curious about children who are out there. They may be in homes where the television is on right now, tuned to this broadcast, and nothing is being done. Is mental illness the sort of issue that gets greater over time? Is this something that snowballs, or can it remain a very either low level, medium level, or high level threat in an individual for a long period of time?
You know, generally depression, mood disorders are chronic conditions, but they get worse at times of stress and at times when resources for coping with them aren't there. I think for someone who's at home currently, it's important that they actually reach out for help, and the people who care for them, look after them, ask how they're doing.
And now we look ahead, Dr. Lucas, and what more do we need in our community right now? What resources do we need to expand upon?
Unfortunately, we need to expand all resources. So from outpatient care to more intensive inpatient programs. But also we need to not rely just on specialist services. I think we need to help pediatricians identify and care for children with mental health issues. We need to help schools being able to identify who's at the most risk and connect them with services. I think it takes the whole community, and really we need to put major funding into expansion of services.
Well, I mean, some of that may come in the new state budget. I'm not sure if you're aware of this, but one of the things that is going to happen in New York State, and these places exist elsewhere, are mental health urgent care centers. The same way when one of Megan's children sprains something and goes to the urgent care, we go there to have a test done or something. This is specifically for people who are in mental health crisis. Can that take some of the burden off the hospitals, and is that a good start in your estimation?
You know, I think so, particularly if you have a particular focus on pediatrics and adolescents, that these can be. For a child who's in emotional distress or has made some actions that put their health at risk, to be lumped in with everybody else who has a broken arm or has COVID, they don't necessarily get the best services. So if you could have a specialist mental health area for urgent cases, I think that would bring up a lot of the
I think it's fascinating. I think it could do a lot of good,
Yeah.
it seems.
Dr. Lucas, what would you say to a child out there who's watching this program tonight, or a parent who recognizes something in their child and they're struggling?
I would say connect. Don't anticipate that if you say something, nobody will do anything, or if you ask something, that you will put the idea in someone's head. Check out how they're thinking, what are they doing, and really try and look for those warning signs of being more withdrawn or of talking about suicide.
I had a mom tell me, say the word suicide if it's age appropriate. Is that something that you would recommend? Actually use the terminology, not dance around?
I think it depends on age,
Okay.
but generally I would prefer to use thinking of killing yourself. Often people talk about, are you thinking about harming yourself? And that can be somewhat different from actually thoughts of ending your life. When I assess someone clinically, you start with questions like, have you thought that life's not worth living, or you'd be better off if you weren't here? Moving on to, have you had actually any thoughts of killing yourself?
Dr. Christopher Lucas, we appreciate your expertise tonight.
Very, very much. This is an issue that, of course, does not just affect younger students.
College students are also seeing the mental health effects of the pandemic. Last month, students at Lemoyne College rallied on campus, calling on school leaders to do more to address mental health issues. It came in the wake of the death of a third-year student.
We're all on the same team. We all want to prevent suicides on campus. We all want everybody to be mentally well on campus. And ultimately, the solution isn't going to be an us versus them mentality. It's going to be working with administration to create policies and solutions that will work now and for the long-term future.
In November 2019, it was Stefano Galante. Friends remember him as a great musician with a great sense of humor. Students now pleading with school leaders to do more to help.
And it was really upsetting to see someone so awesome gone, and they didn't deserve that, and it could have been prevented so easily. I really, truly, genuinely hope that change is made and that we start protecting and saving our students before we lose another Finn.
Over the last 3 years, Lemoyne has lost 3 students to suicide, causing school leaders to re-examine their mental health services, vowing now to do more to help students.
The college is looking into digital screening apps to potentially identify students who are in crisis and wants students to know they're not alone.
These past 3 years, it's too much. One is too many. So it's motivating us to look at more, what else can we do? What do we need to do more of in terms of, like you mentioned, the screenings, the regular check-ins, the education, the raising awareness, to helping change the culture. And they're asking us to help them. And I feel like they're asking us to help them in some new ways. I think, again, we're ready to do that.
And Lemoyne administrators say it's clear students need more than a counselor in a wellness center behind closed doors. They say the college is committed to finding new ways, that new thing, and a way of connecting with struggling students. Mental health counselors are saturated right now with so much demand for help. One local superintendent predicts a mental health tsunami ahead.
And that's where one local organization comes in. Contact Community Services is seeing a spike in need for its services. From 2019 to 2020, the group saw a 30% jump in calls to the 4 hotlines it mans across the state, the biggest increase for the National Suicide Prevention Lifeline. Contact Community Services offers a wide range of mental health services, including a crisis hotline, counseling, and in-school supports.
The group says that school districts are eager to dig in on this issue.
The lives of kids have been so dramatically changed over the last year. They've missed out on so many things. I think they've been traumatized in ways that we may not yet fully know or understand, but I think because we're attuned to it, we'll be on the lookout for it. And we'll all, as a community, we'll all be trying to provide that safety net to help kids come out the other side.
We are here 24/7, and we can even supplement the folks who do have the advantage of seeing a therapist but may need more. So it's great because we can provide the support until someone gets to therapy, but we can also provide the additional support in between sessions.
If you know someone struggling, here are some resources to help. The Contact Hotline is a free, confidential, 24-hour counseling hotline. Crisis Connect is a 24/7 central triage call line. You can also find mental health support by dialing 211.
If you need help or know someone who does, call the National Suicide Prevention Lifeline. The number is 1-800-273-TALK. Or you can live chat with someone online 24 hours a day, 7 days a week. We have a link to those resources at cnycentral.com.
This has been really, really heavy stuff tonight, and we appreciate all of your time joining us.
Yes, and thanks to you for really being a driving force in this. I have learned more than I ever thought that I would learn about this topic. And learning it, I think, at this time that we're living in, is so critical. We would be derelict in our duty if we weren't shining a light on this.
Yeah, you know, at the beginning of the program, we introduced you to Peyton and Colin, those two teenagers from here in Central New York. I spoke with both of them, with both of their moms yesterday. I have to say, for Peyton and his mother, Kimberly, they are incredibly courageous. The bravery that they have displayed, not only dealing with this, Michael, as a family, which is
putting this
but putting it out
there
there to
for
help
other
other families
people to see is
Yeah.
remarkable. It is absolutely remarkable. I would, you know, as I look at that picture of them, I would have never had that courage. I'm not sure that my parents would have had that courage at that age.
And Colin, the empathy that he and his mother showed during that interview, hearing Peyton's story, was incredibly remarkable.
And so revealing about what's truly in all of us if we just dig a little bit, because Colin and his mother arrived to that interview thinking that they would be giving an honest assessment of how things were, but they had no idea the range of emotions that they were going to go through as we sat for 25, 30 minutes talking with both of those families. Bravo to both families. We wish both of those young men nothing but the best.
Yeah.
The whole world is out there for them.
Peyton's mom, by the way, says that he is doing much better. He's been doing therapy. They have a new dog. He's been on some medication, and he's well on his way to recovery.
They have a new dog, which makes me wonder how mom's doing.
Yeah.
That may be a whole nother hour-long presentation. Again, Megan, thanks for your work on this. I truly appreciate it.
Thanks to you for collaborating as well. Thank you for joining us tonight for this really important conversation.
We hope that tonight's broadcast has been helpful and informative for everyone working on this newscast. Good night.